Welcome to Sunway Medical Center Velocity, your multi-specialty tertiary healthcare provider. As one of our core specialties, our women's health offers a range of obstetrics and gynecological services to help women manage their health care, from family planning services, prenatal support to postnatal care, as well as mother and baby wellness. Every parent wants the best for their children. That's why we take a holistic approach to the health of the little ones. Our pediatricians are here to help parents manage the different medical needs of their children at every stage of their lives by evaluating physical milestones, behavioral development, and providing regular health assessments and vaccinations. Health begins with the right preventive care. At our Health Screening Center, we can assess your health status and help you manage potential health risks by offering screening packages to suit your every need. With heart health being one of our specialties, we have a cardiovascular unit that supports you with a comprehensive range of cardiac care, from early to late stages of detection to diagnosis and treatment. This one-stop center is led by a dedicated team of specialists with support staff across various disciplines and equipped with state-of-the-art equipment like the 24-hour catheterization lab. Our neurology department is supported by the best that technology can offer, with a range of imaging services using cutting-edge equipment such as the 3D MRI scanner and the stereotactic image-guided surgical systems. For added convenience, we are digitally equipped with cyber capabilities where patients can review their radiology report online and make bookings anytime with our 24-hour online appointment service. At Sunway Medical Center Velocity, our team of specialists and medical professionals are always there for our patients. They are dedicated to delivering quality health management together with compassionate patient care. In the case of an emergency, our accident and emergency department is available round the clock, with emergency specialists and surgeons on call any time of the day or night to attend to any urgent medical needs. Here with you every step of the way in life. Sunway Medical Center Velocity, your preferred hospital for complete healthcare solutions under one roof. In the integrated township of Sunway Velocity.
Hello. Hi and good afternoon, everyone. I hope everyone is staying safe with your family and loved ones at home. Thank you for joining our virtual Gynae Talk today. My name is Unku Hanim and I will be your host for today. So good news for everyone who is joining our live talk today. And for those who registered, you guys can leave a comment at our comment section. Say that I am here for a chance to win a lucky draw segment at the end of this session, which will win our complimentary gynae screening worth RM 500 ringgit. Okay, so where we will notify these winners via email 48 hours after this talk. So make sure you stay with us until the end of this live talk. So okay, good. I see one comment already said that I am here. Okay, so before we invite our esteemed speaker for today, allow me to share a bit of information about our Sunway Medical Center Velocity Hospital. Okay. Okay, Sunway Medical Center Velocity is a new addition to Sunway Healthcare Group. We are located in a part of an integrated township, Sunway Velocity, which consists of retail, residences, college, and also mall. We are located in Cheras, Kuala Lumpur, and we are just 3.8 kilometers away from KL City Centre. A bit of overview about our hospital. We have officially opened our doors to public since 3rd September 2019. We have over 10-story block and 240 hospital beds. We have over 45 specialist clinics. We have our own cardiac cath lab. We have our own dialysis center. We have our own chemotherapy day ward, and as well as digestive health. Okay. A bit of medical specialties offered by our hospital. So as a tertiary hospital, so we have a wide variety of medical specialties. Some of it are ENT. We also have our own ONG specialists, our pediatric specialists, and many more. Okay, a bit about facilities and services. We have our own accident and emergency department, of course, and our digestive health and endoscopy, as well as surgical daycare ward as well. Okay, some of the photos of our facilities offered here. Okay, and last but not least is a bit information about our room rates here. Our 4-bedded room started from 90 ringgit, and our premier suite is priced at 1,288 ringgit. Okay. So without further ado, let us invite our esteemed speaker for today, Dr. Farah Leong Rahman, who is a consultant fertility specialist, obstetrician and gynecologist, who will be speaking about a common gynecological problems that one shouldn't ignore and would it affect the chances of getting pregnant. Okay. Hello, hi Dr. Farah.
Hi.
How are you?
Good.
Okay, Dr. Farah, why don't we start a bit of information about yourself before we go to your talk?
Okay, hi, I'm Dr. Farah. Yeah, I'm in Sunway Medical Center, Velocity, and also Sunway Fertility Center. Okay, so thank you for joining us on this Saturday afternoon. Okay, I will try to answer as many questions as possible, and I hope you can go back after the talk with some of the information.
Okay, let us start your slides. Okay, over to you, Dr. Farah.
All right, thank you. I can start clicking here, right? All right. Okay. All right. So today I'll be talking about what are the gynecological conditions that you should know. And so if you want to talk about these conditions, we have a lot of conditions to talk about, but we will focus on some of the common and some of the more serious ones. And we also will talk about whether these conditions will affect the chances of you getting pregnant or not. Okay? Okay, so before we start, we should know about our female organs. Yeah. So this is our female reproductive system. Okay, this is what we call the uterus, the womb. Okay, we have left and right fallopian tube. This is the tube. Okay, this is the other side of the tube. This is the ovaries. All right, this is the cervix, and this is the vagina. Okay, so in a normal female, every month, what happens is in the ovary here we have eggs, and during your fertile period, your ovulation period, one of these follicles or eggs will grow big and mature. So when it's big and mature, it will be released into the fallopian tube, and then it will enter here. And if you have sex during that time, the sperm will swim, and the sperm will meet the egg at the fallopian tube here, and the baby will form an implant on the womb, which is this area here. So this is the endometrial cavity lining. So in order for a pregnancy to happen, we have to make sure that this area, this cavity here, is not blocked by anything. The environment should be very nice and conducive for the baby to stick. So for example, if the sperm doesn't meet the egg, then you will have period and the period blood will come and flow out here. Okay, so this is our female reproductive organs. Okay, so a lot of questions they ask, like what to look out for, when do I see the doctor, is my period normal or not? So basically, not every female will have the same period cycle. Not everyone will have a textbook 28 days, 30 days. Okay, so basically, if your period is infrequent, irregular, meaning that you have your period once in 3-4 months, once in 6 months, then it's best to see the doctor. Okay, or if you feel that you have very, very painful period, painkiller doesn't work, you have to lie in bed, take MC for about 1-2 days, you cannot work, then also it's something to think about going to see the doctor to see if there's anything wrong or not, okay? Or if you have heavy bleeding. So it's quite normal to have heavy bleeding the first few days, okay? But if it's anything out of the ordinary for you, like every 1 hour you have to go to the toilet to change, or the blood clots keep dripping out, is something not normal, then of course as well go and see the doctor. Other things that we should look out for is bleeding after sex, painful sex, that means you cannot have penetrative sex, okay, difficulty in having sex, or tummy pain. So this tummy pain could be whether it's related to your period or not related to period, okay? Or you feel that your tummy suddenly grow a bit bigger, yeah, you're unsure, then of course come and see the doctor. So doesn't mean that if you have one of these problems, you will definitely have a problem. So it doesn't mean that if you have period pain, sure got problem one, not necessary, okay? So when we talk about abnormal periods, okay, so when we talk, or when I ask my patients, I will ask, okay, how is the flow? Is it heavy? How many pads, how many tampons to use? Is it very full? Is it just half? Okay, and then is there any clots, big chunks, clots, and how long is your period lasting? Is it 7 days? Is it 14 days? Okay, and also another thing that it's important is you shouldn't bleed in between your periods. So for example, if your period is like 30-day cycle, so from one period to the other period, you shouldn't bleed in between. You shouldn't have like 3 days bleeding. Okay, so bleeding in between, it's not normal. Okay, so please also go and see the doctor. And like I've mentioned just now, painful. So pain is something very different for every woman. Okay, some they will feel that the pain will be a bit more. Some women can actually take the pain very well. Okay, so pain is a very different perspective for each woman. Okay, and the most important question is it affecting your life? So for example, if you have pain the first, second day, but you take Panadol and you feel fine, you can still go out to work, you can still go out to do your normal life, so that is fine. But if you take painkillers, it doesn't work, you have to lie in bed, you cannot go out the whole day, the first 2 days you have to subject yourself in the room, then it's not something good. That means if it's affecting your life, then yes, please go and see the doctor. We will help you and see, is there any better painkillers to give, is there any other hormonal treatments to help you with, okay? All right. So like I've mentioned, when we say heavy bleeding, we cannot quantify it. It's very difficult to quantify. I cannot ask you all like, oh, how many mils? I'm sure none of you will actually measure how much bleeding you have. So it's very difficult to define how much heavy bleeding you have. But most women will lose less than 80 mils during the entire period course, which is about 16 teaspoons, they say. Okay. But the important thing to note is you will know if you have heavy bleeding. You will know whether it disturbed you, because all this while you've been having periods. So if suddenly like 3-6 months you realize that my period is a bit different, it's a bit heavier, then it's abnormal. Okay, so what are some of the causes of abnormal periods? Okay, so I've listed down some of the causes, but of course there are more, but these are some of the important ones. Okay, number 1, fibroids, polycystic ovaries, endometriosis, endometrial polyps, rarely cancer, and also certain medical conditions such as if your thyroid levels are low. Okay, I'll be talking about each one of these causes. Okay, but again, no cause is found in 50% of these women. So like I mentioned, you might not have a problem, or you might not have fibroid or endometriosis even if your period is abnormal. Okay, so now let's talk about fibroids. So what are fibroids? So fibroid is quite common. Yeah, it's a non-cancerous growth on the womb, and I get quite asked a lot, what is the exact cause? So we still don't know what is the exact cause of fibroids, and most of the time the ladies, they are unaware that they have fibroids because these growth sometimes they don't show any signs or symptoms. Most of them, they will come for an annual check or a monthly check, and such a coincidence, when the doctor scan them, then they will find, we found a growth. Or for example, they feel that, my tummy is a bit hard, or when the period is very heavy, when they go and check, then coincidentally we find a fibroid. Okay, so most of them, they will not know whether they have fibroids or not. Okay, so most of these fibroids, they don't cause anything, but if they do cause, they can cause heavy periods. So when we say growth, it can grow at different sizes. It can be at different areas. Let me show you some of the pictures of the fibroids. Okay, so this is a diagram of, this is the uterus. If you remember just now, the uterus doesn't look like that, right? The normal uterus. So these are fibroids, these round structures. So you see, they have a lot of sizes, different locations as well. So this is the one large one on top. We have another few ones here. So these are all small growths. So which are the very serious ones? Okay, so like I've mentioned, this area here, the endometrial lining, is very important for baby to stick. So anything that it's blocking, such as this fibroid here, or the one that is, you see, is distorted the lining, yeah, it can cause difficulty in getting pregnant, or it can actually make the environment not so good. Okay, so in this kind of circumstances, then we need to do some treatment. Okay, so these are real-time pictures. So this is a fibroid that's in the uterine cavity. So usually in the uterine cavity, meaning that the baby will actually stick here. So just imagine if you have this big little growth. So of course the environment inside is not very nice for baby to stick. Okay, so in this kind of circumstances, yes, we do remove these fibroids. And this kind of fibroids that's inside the cavity may cause heavy bleeding. So this is also another picture of a lot of fibroids. Okay, you can see multiple sizes and shapes. All right. So what are the treatments? Okay, if not everyone will have the same treatment for fibroid. If the fibroid is not very big, it's small, it doesn't disturb your period, it's just found coincidentally, then we can just monitor on ultrasound. We can do a check, maybe repeat a scan every 4 to 6 months, okay, just to make sure it's not getting bigger, it doesn't disturb you, okay? But if, for example, if the fibroid is not very big, but it's causing you very heavy bleeding, then we can give you some medications to help reduce the flow, or we can even give you some hormonal treatments to try and reduce the flow of the period. So basically to prevent heavy bleeding, okay? And of course, the last resort is surgery. So not everyone needs surgery unless if the fibroids are very huge, okay, or it disturbs the lining and you're trying to get pregnant, okay, or if you tried medication, you've taken hormonal pill, but it doesn't work, it still causes your period to be heavy, then yes, surgery will be indicated. But not everyone needs surgery. And most of this time, if the fibroid doesn't disturb you, when you reach menopause, usually the fibroids can or may shrink to a smaller size, okay? Okay, now we move on to endometriosis. So what is endometriosis? So endometriosis is where the tissue of the lining starts to grow outside, okay? It can grow in the ovary, the fallopian tubes, the bladder, and the bowel, okay? So not everyone, again, will know that they have endometriosis. And some women, the problem or the symptoms may be different from another woman. Okay, so what are some of the symptoms? Very common in endometriosis they will complain of very, very, very painful cramps. Some of them even say that the period pain, it happened throughout the period or in between period, they will still feel some dull pain or cramping, okay? Heavy bleeding, it may have also in endometriosis, lower tummy pain, back pain, and pain during sex. So they feel that when they have sex, they feel a very deep pain, okay? It can or may be associated with endometriosis. And in not all endometriosis will cause problems getting pregnant, but some may face a bit difficulty in getting pregnant. So these are some of the pictures of endometriosis. So if you can see, this is a picture of a scan. So this is one of the ovarian cysts. So this is the collection of the endometriosis. Okay. So when we do a surgery, this is how it looks like. So endometriosis, when we do a surgery, it comes out like a bit of like chocolate material. Yeah. So this is like the chocolate. So some people call endometriosis as the chocolate cyst. Okay. In another word. So this is the chocolate cyst. And this picture shows that there's also another chocolate cyst here. And there's a lot of all these, you see, all these adhesions, what we call sticky, flimsy type of parts, okay? And you can see all these small chocolate dots here. It can stick on your tube. It can stick on your bladder, yeah? In rare cases, it can stick on your bowel, or very rare, it can happen in your lungs as well. Okay, so this picture shows that this lady is very much in pain, yeah, because very common with endometriosis is period cramps. So how do we help patients with endometriosis? Again, we'll try the simplest thing first. You can relax, you can put on some music, try and meditate, you can put some hot or warm pack on your tummy to try and calm the pain if it works. Okay, if it doesn't work, then please take painkiller. A lot of patients ask me, will it harm my body if I take painkiller every single month? So I always say, when you take a painkiller, you're not taking painkiller like every day for 30 days. You just take on the days that you think it's necessary. So it shouldn't be a problem. But rather than you cannot go out from the house, you cannot go for meetings or work, so that's even worse because it's disturbing your quality of life. So painkillers, when you take necessary, it's actually okay. It doesn't harm your body. All right. So if painkillers doesn't work, what happens? So of course, we have hormonal therapy to help you with the pain. And most of the time, it should help. And the last resort, again, is surgery. So as you can see, if a patient with fibroids or endometriosis, not everyone will definitely need surgery. Okay, so surgery is indicated if the cyst is huge, if you're having pain all the time, we cannot treat it, or in order to help you to get pregnant, then only we do the surgery. All right. Okay, so what is there a cure for endometriosis? Unfortunately, there is no cure for endometriosis, but our aim is help to reduce the symptoms so that you will have a better quality of life, so that this disease will be under control, so it doesn't get worse. Okay, but there is actually no like cure for endometriosis. So very important question, because as I mentioned just now, it may have some of you may face difficulty in getting pregnant if you do have endometriosis. So will it affect my chances to get pregnant? So it doesn't mean that you will have a problem getting pregnant if you have endometriosis. Some you will get pregnant naturally without any help, but some may need assistance like IVF, or some may need to go to do a surgery first before getting pregnant. Yeah. So in each woman, the treatment or the steps are different from one to the other. Okay. So now let's move on to polycystic ovarian syndrome. Yeah, most of them call it PCOS. So it's actually very common, and I do see it very often in ladies who is very young, early 20s, or even in late teens. But I also see it in a lady where their age is about 30. Okay, so it doesn't mean that in an older age group, PCOS doesn't happen. Okay, so it does happen as well. So again, we do not know why the exact cause of PCOS, but it often runs in families. So how do we see whether it's PCOS? So this again, the picture, all right? So a healthy ovary looks like this. Okay, in a polycystic ovary, you can see all these small white dots. So these are all like cystic follicles. That's why it's called polycystic. Poly means a lot. Okay, cystic means all these small fluid filled. Yeah, so you can see a lot inside the ovary means polycystic. So when it's a lot of eggs, usually PCOS patients have a lot of eggs. So how to qualify these patients whether they actually have PCOS or not? They have to at least fulfill 2 out of these 3 criteria. So first is irregular, infrequent period. Like I've mentioned, once in 3-4 months, okay, or 1 year 2-3 times, okay. Number 2, excessive male hormone. So how do you know you have excessive male hormone? So besides taking blood and see if you have extra male hormones, some of the features that we can see, if you have oily skin, a lot of pimple, unwanted hair at different areas, like unwanted fine hair here, okay, balding, okay. So these are some of the symptoms of excessive male hormones. And number 3, polycystic ovaries. How do we know? Is by ultrasound. So when we scan, we see a lot of small fluid-like structures. So these are features of polycystic ovaries. So if you fulfill 2 out of these 3 criteria, then you have PCOS. So why are we so afraid of PCOS? So if PCOS is not well controlled, in the long term, you may get diabetes, high blood pressure, high cholesterol, leading to heart attack. And if your periods doesn't come often, there is a risk of cancer of the womb. Okay, that's why we have to ensure that your periods come regularly. So again, of course, will I have a problem if I have PCOS? So in fact, PCOS is one of the most common cause of female infertility. Why? Because when you have infrequent or irregular periods, you don't ovulate. Okay, meaning that, like I told you before, the follicles start, when they start, you have very small follicles. Then when you reach your fertile period, like waktu subuh, then one of these follicles will grow very big. And this is mature. When it's mature, it's big, then only it will be released, which is ovulate. But when you have PCOS, when you have irregular periods, all your follicles are very small. They don't mature. So when they don't mature, when you have sex, you don't have that fertile period. So we cannot time exactly when is the most suitable time to have sex, because you don't have this fertile period. Okay, so that's why these patients they have difficulty getting pregnant, because they don't know when is the waktu subuh. Okay. So in this picture shows a scan picture. So this is the normal ovary. Then this is what I call the follicle, this black. But in polycystic, a lot of follicles all around this. Yeah, so this is called a polycystic ovary. Okay. So how do we know whether you ovulate? How do you know that this is your fertile period or waktu subuh? When we scan you, we see one of these follicle or egg very big. You see, compared to the other small eggs. So when I measure, I can see this is large. Then I will know that, okay, your fertile period is coming. Then I can advise you, okay, when to have sex. Okay, maybe go back today, the next day, every other day. But if I don't see any follicle that's growing, all I see is just small eggs, then I know that you are not ovulating normally. Okay. So what are the treatments of PCOS? So very important, lifestyle change. Yeah, basically try and lose weight. Yeah, weight loss at least about 5% can actually help to regulate your hormones. Okay, so being too skinny, too underweight, it's also not good. Being overweight also is not good. So your body mass index should be in between 20 to 24, okay? And leading a healthy lifestyle, exercise, okay? So it's very difficult. I mean, not everyone will want to go and run a marathon, or now that it's MCO, it's very difficult for you to go to the gym, right? So any form of exercise or anything to increase your heart rate, it's good. For example, instead of going up, like wait for the escalator, elevator, you can actually use the stairs. When you use the stairs, you're also pumping your heart rate. Okay, use the stairs instead of the lift. Okay, you can maybe skipping ropes at home. Yeah, do some house chores. Try and exercise and sweat. Okay, 2 to 3 times a week. It's better than no exercise at all. Okay, and of course, eating a healthy and balanced diet. Cut carbohydrates, sugar also has to be reduced. Eat more vegetable, high fiber diet. Okay, so not everyone will need hormonal treatment. Okay, so if your period comes every month, or if your period comes once in 40 days, I'm happy. You don't need to be on hormonal pills. But if your period comes very rare, like once in 4 months, then I may need to give you some pills to make sure your periods come every month, okay? Or at least every 3 months, okay? And for PCOS patients who their eggs doesn't grow big and they want to get pregnant, there are some of the medications that we can give during period, yeah, to help to stimulate these eggs to grow, yeah. And you take it from day 2 period, yeah, for 5 days, and then you come in for a scan at about day 12, day 14, and from a scan I should see 1 or 2 eggs that's growing, yeah. If you respond to the medication, then I can advise you to go back have sex which day, which is the ideal time. Okay, so the next condition is endometrial polyps. So again, it's a non-cancer growth inside the womb. And like other conditions, a lot of you will not know that you have it, okay? But if you do have it, you may have some of the symptoms, which is bleeding in between period. So like I've mentioned, you shouldn't bleed from one period to the other, okay? So if you bleed like in between day 13, day 14, a bit, you might want to come in for a check to see whether you have endometrial polyps or not. Endometrial polyps can also cause heavy bleeding or bleeding after sex. Again, surgery is only indicated in certain cases. So you can see this in an ultrasound picture. This round little long structure here is an endometrial polyp. Okay, so this picture is before the surgery. You can see these are all polyps. So just imagine, this is the uterine cavity. Baby usually implants in this cavity here. If the structure here is not nice, there's a lot of polyps growing, how is it, the environment is not nice for the baby to stick, right? Yeah, so that's why in these cases, we do perform a surgery to clear the polyps so that the environment is much nicer for baby to stick. You see, after the surgery, this is how it looks like. Okay, so much cleaner, there's nothing blocking the endometrial cavity, and baby can implant better. Okay, so this is an ultrasound picture again. So this is the lining. Okay, this is what we want and what we are looking for. So for patients who are planning for IVF or with even no IVF, if we see these 3 lines, it's a very good line that it's a nice environment for baby to stick. This is called the triple line. Okay, you can see it, 1 line here, 2 lines, and 3 lines. Okay, so when you have triple line, or I can see a triple line, the chances of implantation is quite good. All right, so this is an embryo at about 5 weeks pregnant. The baby implants right in the middle, which is this area here. Okay, so any advice? Okay, so the most important is, even if you have no problems, you may think your periods are normal, it's best also to have like annual check just to make sure, because as I mentioned, we've gone through fibroids, we've gone through polyps. These conditions may be very quiet. You may not have any symptoms, you don't have warning signs, nothing. So it's best to get it checked, okay? And if you have done any previous checkup before, or you know you have a fibroid, so you have a report. So bring to the doctor so that we can compare. Like last year, if let's say, for example, last year your fibroid is 2 cm. So obviously, when we check, we want to make sure that it's not significantly increased in size. Okay, so bring your reports to the doctor. And also we can examine your breast, we can check the tummy, we will perform an ultrasound to see whether you have any cysts, any fibroids, any abnormalities, and perform a pap smear as well. So this is generally what do you expect when you see a gynae doctor. That's all, very short, my slides. Any questions?
Thank you, Dr. Farah, for sharing over a very great topic today. So I would like to open for Q&A session from the audience. We have some already here, but for those who watching, you can still ask your questions and we will try to answer whatever we can. Okay, I think, okay, Dr. Farah, there's one question. You can see from the screen. How about slight bleeding during the 13 to 14 of the cycle? I assume it's cycle of period.
Yeah. Okay, so this is called intermenstrual bleeding, which is bleeding in between periods, like I say. Okay, so if you haven't gone to the doctor, please go and see the doctor so we can do a scan to see your lining. Yeah, is there anything that it's inside, such as polyps or growth? Yeah, and then we can take things from there. Yeah, so yes, you have to go and see the doctor because bleeding in between periods are not normal.
Okay, I also have some questions DM personally to us. This person is asking, I suffer from a very painful period pain. How do I know when is the best time to visit specialists?
Okay, so if you have period pain, there is no like exact time like when to see the doctor. Okay, you can come at any time during your cycle. If your pain is on the first day, second day, you're bleeding a lot, if you need to come, you can drop by. So there's no exact timing as when to see the gynae. Yeah, you can come and see us at any time.
Okay, so bring us through this one more questions about period pain. What if the pain comes badly only for a certain month? Asking on behalf of my daughter.
Okay, so some period pain, it's a pure period pain, meaning that when we scan, I don't see any abnormality. There is no cyst, no fibroid. That's a pure period pain, which can happen as well. Yeah. So the most important thing again, do a scan and take a look. If there is nothing abnormal, if painkiller works, you can continue with painkillers. If the painkiller doesn't work, then of course we will have to step up to a different level. Yeah, but it's true, not everyone will have period pain every month. Some months are worse, some months is better.
Okay. Still questions on period. Is it advisable to take any medication to regulate period, doctor?
Okay. So first, I need to know whether are your periods regular or not first. Yeah. If you're having your periods, I suppose that maybe your periods are not regular. So if your periods are not regular, then it depends how often do you get it. So if your periods about once in 35, once in 40 days, that's all right. Yeah. So not everyone will have period once in 28 days. That's like a textbook. But some women, they get their periods once in 40 days, once 45 days. That is all right. Yeah. It's only that if your period comes your period doesn't come more than 3 months or 4 months once, then yes, you may need hormonal tablets to regulate the period.
Okay. Okay. What about if period comes twice in a month? Some of my friends also suffer from this kind of problem sometimes, doctor, which period comes twice in a month, sometimes they don't come.
Yeah. So we usually have to look back. We just don't, I usually don't take just that 1 month and see what happened. I usually ask back like, okay, how is it? If every time, all these previous months, your periods are normal, and then just this month, twice in a month, go and for a check. If everything is fine on scan, no problems, you may want to observe a couple of months after. Yeah, your periods may get back to normal after that. But if every month you've been having twice a month, twice in a month, then obviously something is wrong. Yeah.
Okay, doctor. I think a bit more question here. Okay. This person is asking if fibroid can happen for person who don't do sex. Can fibroid happen for person who don't do
Yes.
sex?
Fibroids is quite common. Okay, it can happen whether in a person who have never ever have sex. Okay, so it has no relation whether you have sex or not. It can happen even when you have never had sex. Yeah. So the answer for that can happen. Yes.
Okay. A bit more question here. If period comes once in 20 days regularly, is it normal after surgery, doctor?
Okay, so first we need to know what surgery is it that you've gone through. Yeah, is it a minor surgery? Is it major? Is it a surgery that it's related to the female area or not? Okay, so but if your period comes once in 20 days, okay, so usually I would take as like 21 to 35, 40 days, it's okay. Yeah, but not shorter than that, not longer than that. But it will be good to know what surgery you have gone through first.
Okay, maybe one question that DM to us personally is this person said, "Hi, Dr. Farah. I am 28 years old, single woman. No plan to get married yet, but definitely would want children in future. I heard that once you turn 30, the chance of getting pregnant is low. Is this true? And why? And is there
Okay.
anything that I can do, like taking supplements or anything?"
Okay. So, as a woman, when we are born, we are already born with the fixed amount of eggs already. Okay, and then when we start having our periods, the number of eggs will start to drop. Yeah, and this drop is significant when you hit 35. So the numbers of eggs will fall, and not only the numbers of our eggs will fall, the quality will drop as well. So in general, we would say that if you have been having regular sex for a year, unprotected regular sex, about 80% should get pregnant within that 1 year. So if you've been trying and unfortunately has been unsuccessful, please go and see the doctor. Then we can do some of the necessary tests and check.
Okay, I think I will check another like 2 questions here. Okay, doctor, would you recommend to take folic acid as a supplement?
Okay. Yes. So if you are trying to get pregnant, having a healthy lifestyle, good diet, it's very important. And folic acid in particular is very important. Yeah. So yes, you please take a folic acid. It's recommended. Yeah. Before you get pregnant, and even if you're pregnant, it's also recommended as well. Yes. So please do take folic acid.
Okay, doctor, maybe one more question. This person is asking, my best friend is suffering from a very thick vaginal discharge. She said sometimes it's yellowish to greenish color almost every day. So is this a red flag of a gynae problem, doctor?
Okay. So I didn't put the topic of the discharge inside my talk today. Okay. Yeah. But so women will have discharge. Okay. If the discharge is normal, clear color, it's not smelly, it's not itchy, it doesn't disturb you, then it's something that we don't need to be worried so much lah. But if the discharge is very abnormal, it's greenish, it's very thick like cottage cheese, it is fishy in smell, then yes, or itchy, then it's not normal. It may be a fungal infection, it can be a bacterial infection. So then you please get it checked.
Okay, I think that's all the questions that we managed to answer for today. So why don't we move to the last agenda of this talk today, which is a lucky draw segment. So as mentioned earlier, so for those who registered, only get a chance to win this complimentary gynae screening. So we would like to get Dr. Farah to pick 3 lucky names from the bowl and show to the screen.
Okay, so
Yeah.
your names are in the bowl.
Firstly,
Okay, the first name is. Cannot see. Sorry. Suzrin
Rin
binti
Binti
Sahaini.
Sahani. Okay.
Okay. All right.
Okay. First
So
name.
another one.
Right. Yeah. Another two names.
I also got problems looking. Oh my goodness.
Nur Hidayah.
Hidayah binti
Jankat.
Jankas. Okay.
Yes. Okay.
And the last one.
And the last name. Last
Okay.
one.
The last one. Okay. Ayo, goodness.
Miss Lee Pei
Lee
Chin.
Pei Chin. So congratulations to all three.
Congratulations. Yes. Okay. Thank you so much, Dr. Farah. Okay, so for
Okay.
the winners, we will email you within 48 hours after this live talk ends. Okay, so I'm afraid that's all the time that we have today, Dr. Farah. Thank you so much for your time, for sharing the great topic with us today. So for those who watch us today, be sure to follow us on our social media accounts for more details and information on our future events, promotions, and etc. So for those who have questions, can be sure to also email us on smtvinquiry@.com.my. Okay, thank you so much, Dr. Farah, for your time
Bye.
today.
Thank you for watching.
Everybody is saying thank you to you too.
Okay. Thank you.
Thank you. Bye-bye.